Hello everyone, good afternoon. I am Dr. Nisha Bhatnagar, Medical Director at Aveya Fertility and IVF Center. Welcome to our YouTube channel. Today we are going to talk about donor eggs and the process for donor eggs. So what is donor egg? Donor egg is eggs donated by a female for the use of a couple who are infertile or for some reason are not able to have children because of low ovarian reserve or poor egg quality or because of some genetic problems or because of age. This is simply eggs taken from a female of younger age group who has a proven fertility preferably and is willing to donate eggs to this couple. So the process is easy. The female takes injection for 8 to 10 days. She goes for regular monitoring by ultrasound. Once the egg reaches around 18 millimeter, final shot is given and these eggs are taken out. Then they are mixed with the husband of this couple. The embryos are created and they are transferred into the female. Now most of the people are worried about the fact that this female should not have any right on the eggs given by her. So no, she has no right on the eggs given by her because she signs a consent stating that she has no right. These eggs she has donated to this couple and she has no right neither on the eggs nor on the babies born by these eggs. So you don't have to worry about that part. So how do you get the donor? There are two ways of getting a donor. One thing is that you can get a family member to act as your donor. Second thing is that you take the donor from a ART bank. So the centers have registered ART bank. They are in collaboration with registered ART banks. Now the Indian law states that one donor can donate eggs once in lifetime to one couple only. So she cannot donate multiple times and there is a national registry for that. So whosoever wants to go for donor egg, usually we get the profile from the bank. We match it with the couple's profile, we see the height, weight, basic information, color of hair, color of eye, color of skin, how many children she had and what is her education, what is the family status, like what is the sibling number, how many siblings she has, any genetic history, any history of any congenital malformation or defects, or all these history we put together along with the history of parents and grandparents, and then we match the profile with the couple, and once a profile is matched we can choose this donor for this particular couple. Now you also need to remember that there can be a specific genetic testing done for the donor to rule out if she is carrier of some genetic disease like thalassemia or something else. So all these things can be done, it is possible to do that. Once the embryos are created, they are frozen in the name of the patient. The donor has no information about the couple. She does not know to whom the eggs are donated to. She just donates the eggs and signs this consent. Now who needs donor eggs? Any female who is more than 42, 43 years of age, she is not having a live children, her AMH is low or the egg reserve is poor or there is some genetic problem or history in the female for which she cannot use her own eggs, can opt for donor eggs. In cases of recurrent implantation failure or recurrent pregnancy loss also, sometimes donor eggs may help. Now one thing patients are worried about is that whether my genetics will come or not. So let me solve this as a puzzle. So when a patient is getting pregnant, you have the female is contributing by the way of giving her eggs and by the way of carrying the baby. So the contribution of female is around 33% plus 33% around 66%, and the male contributes by way of giving the sperm, that is another say 33%, that makes 99%, 1% is epigenetics. So now when a female is taking a donor egg, the husband's sperm is still there, she is still carrying the baby, so around 67% still it's their own baby, only some part they are getting by the way of taking a donor. So you don't have to worry about that. There is genetics definitely are going to come from donor only, and the couple and the husband's genetics are going to be there. The female may contribute by virtue of carrying the baby in terms of epigenetics. What she eats, what she drinks, what she thinks, what she listens to, what she reads is all going to affect the growth of the baby. If you have any more questions about this, or if you want to ask more information about this, please feel free to contact us at the given numbers. As early as possible, we will try to answer the questions. Thank you so much.